I chose to speak about the hepatitis C disease and the management of its patients. The background of this hepatitis C is an inflammation of the liver and is due to a viral infection. It affects the liver, also known, Hep C is also known as HCV. It can be acute or chronic, and it's the highest reported age of 2018. In 2018 are the ages of 20 through 29, and it's an emerging disease. Between 2003 and 2010, approximately 1% of the U.S. population are infected, which is about 2.7 million people. Hepatitis C can either be, the rate of hepatitis C is low. The hepatitis C is a chronic, often asymptomatic bloodborne infection, and it's identified in the early 1990s. Up to 4 million Americans are believed to be infected with the indolent disease, or this disease, this chronic disease. The objective of this study, it's a retrospective medical review of care that's provided to all patients within the Olmsted County for this article or journal article, which is in Minnesota, who had a confirmed diagnosis of hepatitis C. And the records that were used are from all healthcare providers within that county. And the rates of the documented discussions regarding hepatitis C and its treatments by specialty of diagnosing physicians were assessed. Olmsted County, Minnesota is a metropolitan statistical area of about 120,000 residents and includes the city of Rochester. The county is 90 miles south of Minneapolis and St. Paul, medically isolated and surrounded by rural agricultural land. Olmsted County residents are served by 2 medical facilities, and the Olmsted Medical Center and the Mayo Clinic, which provide primary and tertiary inpatient and outpatient care locally. For the study of adults, generalists or primary care physicians are defined as family physicians and general internists. The overall aims is to set up a national database of those infected through administration of blood or blood products. And it's to follow the natural history of the disease, monitor it, and evaluate it. Almost 2/3 or 64% of 366 registered patients had a discussion in their medical records, including 55, which is 15% who received actual treatment. The population covered a total of 366 patients with the Hep C virus. 62% of those were men, and Hep C is more commonly diagnosed by general physicians, and there's 41% of those cases out of 366 of those patients. Treatment discussions were documented for 77% of the patients with Hep C diagnosed by either a generalist or the GI specialist, the gastroenterologist, compared to with 46% of patients with Hep C diagnosed by other physicians alone. Generalist patients were more likely to have documented the treatment and were only 1/2 as likely to receive the treatment for Hep C compared to patients with Hep C diagnosed by GI specialists. Many with Hep C received diagnosis from their generalists, except 11 patients with end-stage liver disease that were not referred. Those who may have potentially reversible results did not document attempts to treat. None who initially refused therapy were reassessed when new treatments became available. which is a problem because if they were treated and were assessed properly, this would be a lower percent of people who are diagnosed, especially if it's reversible at an early stage. Also, knowing that a lot of people within every 6 months are to get abdominal ultrasounds or bladder ultrasounds or even nuclear medicine bone scans of the whole body just to assess their treatment and to find out if they have any other diseases existing with their Hep C virus that they have obtained. The type of study for this exam is a retrospective cohort study. It's a retrospective study that looks backwards and examines exposures to suspected risks or protection factors in relation to an outcome that is established at the start of the study. This cohort includes only physicians diagnosed hepatitis C. Within the Olmsted County, prevalence is about 1/10 the rate reported for the Midwest by the National Health Examination Survey. The reported sustained viral response rate of 38% in the 55 patients who received treatment is difficult to compare with the result of clinical trials because the patients received different kinds of treatment during the more than 10 years that it was studied. The recruiting strategies, use of medical records to obtain the analysis. The calculated Olmsted County prevalence is about 1/10 the rate reported for the Midwest by National Health and Examination Survey. The inclusion criteria of this study, there's a total of 55 adults who received treatment for Hep C, 37 men and 18 women. 16% of those patients whose Hep C was diagnosed by a generalist received, compared with 33% of the patients who had Hep C diagnosed by a GI specialist. Of those 55 patients receiving treatment, 21 had a sustained viral response. The treatment documented during the 10-year period, including interferon alone and interferon and ribavirin, interferon, ribavirin, and etanercept. The exclusion criteria would be race and their prior health status. In the report, it did mention that some were pregnant during the admission of Hep C. They excluded the use of drug and alcohol-related issues. They did include, that's inclusion, excuse me. So exclusion, they with the race factor, since it was a rural county that had not much diversity, and such a small county, it excluded an important factor. And the authors concluded that the generalist is central to community-based Hep C management. The generalist's role can include recognition of screening for and diagnosis of the Hep C, and also the identification of it, monitoring of it, and the treatment for potential reversible treatment, and administration of or referral for Hep C specific therapy. The small amount of racial diversity in the Olmsted County population potentially limits the generalization or generalizability of the results. Even so, this predominantly white and rural population had hepatitis C risk factors comparable with more urban and racial diverse groups. So that also leaves out how and why. It leaves out how many of these people know each other and how many people have interaction with each other in regards to possible drug use or alcohol use. In conclusion, many patients with irreversible contraindications to Hep C therapy receive their diagnosis from generalists, and most, except for about 11 patients with end-stage liver disease, were not referred to a GI specialist. Patients with potentially reversible contraindications were seen by all specialty groups. Patients with potentially reversible either did not have documented attempts to treat the potential reversible disease, or any notion of reassessing treatment eligibility after treatment or resolution of the comorbid condition or financial situation. The bias in the study, the prevalence reported here is unlikely to reflect the entire population of the Hep C virus infected persons in Olmsted County. The use of medical records to determine discussion or considerations of the treatment assumes that the records reflected what occurs during the visit, although other studies show that documented activities almost always occur. The areas of omission is documented limited this methodology. And lastly, the ideal study design for this exam, for this case study, the best study I believe would be a case control study due to it being a 10-year study.